Parkinson's disease is a central nervous system disorder, and it's the hallmark for Parkinson's disease is what we call postural instability. What happens actually is the portion of the brain that makes a neurotransmitting chemical called dopamine doesn't produce it in adequate amounts, and so dopamine allows us to move. It allows us to um, stand up, move around, move our muscles, move our face. We don't think about these things as in the general course of a day, but individuals with Parkinson's will develop symptoms of stiffness, or rigidity is what we call it. Remember, the brain is divided in two, and one side of our body is oftentimes more affected by a disorder than the other side. So people will commonly notice stiffness, rigidity, difficulty moving their arm or leg on one side of their body. Sometimes people come in where I've seen people present with pain in their shoulder, and I was thinking that they were having symptoms of a problem with their neck. But when I started watching them move, you could tell that the limb, the arm was stiff, and it was hard for them to move it. So because we have less dopamine in our system that allows us to move, people become rigid, and when they become rigid, stiff, the limb doesn't move properly. And as that progresses, they can have difficulty going from a seated to standing position. You notice that they have less facial movement, so less blink. Their face, their affect and their face can get kind of flat. They tend not to have spontaneous movements of their face or their body. Some of the symptoms that can occur before the person is actually diagnosed, people can notice that they exercise less, they get out and move around less, they can have problems with constipation, they can have problems with speech. Interestingly, and I don't know exactly why this is, but there's some speculation that people lose their sense of smell about 5 years before they ever have any Parkinson's symptoms. One of the symptoms that people think about with Parkinson's is tremor, and so they think about a slow kind of pill rolling tremor with the hand, and actually that's a late symptom of Parkinson's. One of the earliest symptoms that people have is this postural instability, and it's because their muscles are stiff and rigid, so they can't respond as their position changes, either whether they're seated or standing. So that postural instability, where they feel like they're not quite right with the planet, I think is the thing that people are concerned about most when they come in. But they can develop tremor later on. It's kind of a late symptom of Parkinson's.